No, I guess not.
Okay, we'll go ahead and call the special meeting to order. And then, you want the citizens' comments first or later?
I would go with your discussion first, but it's up to
Okay.
you.
The reason I thought we ought to meet is I've had 20, 30 phone calls, and I found out I really didn't have the answers to those people to be able to answer them. And probably the main one is the first one, what a mass gathering really is. And I don't know, but I thought it maybe should be unless 6 foot social distancing can be maintained in that same sentence. And also, I visited with our county attorney. I also visited with another attorney that think that churches have already been exempted in that. They probably ought to be mentioned because a federal judge said that the orders can't pertain to churches. I think that probably ought to be included in there.
Okay.
And I think, this is just my opinion, but in the schools, I think we ought to clarify that if one happens in one school, it doesn't necessarily pertain to all the other schools.
Which I talked with the schools yesterday and told them that we probably should have a meeting all together to discuss that, so.
That, I don't think we're very far apart, but I would like to see those two things clarified.
I had a lot of calls yesterday too, and I just wanted to clarify, I had a couple of calls from the Maxville school and a couple of teachers and coaches, and they thought that where we're at the mass gathering at 30 people was the whole school, and I kind of understand it as long as it's not more than 30 people in one room. And then they asked about their football practice, if they could have the high school on one end of the field and the junior high on the other end. And I said, I think that's split enough. I never thought about it the other day, but I've had a couple of calls from the Welch Farm venue, and he said they have a couple of wedding, receptions and different deals like that, where their venue is outside, and then they have a huge area, that they can spread people out and kind of set the stations out. I mean, is there any way that we can do, a venue like?
Well, if I change the wording like he said to 6 foot social distancing, then that takes care of that.
Okay.
We could add the word in a building per room too, maybe.
Okay.
I mean, I can see, you don't want a gymnasium or auditorium full of people, but if you're outside, so,
But people have looked at this and thought, well, probably the courthouse ought to be shut down, the school ought to be shut down because there's more than 30 people in there. But I don't think
that
that
would apply to
was
grocery stores and everything else too, and we can't shut all of those down either.
right. But when people ask me that, I say, I just don't know what to tell you. So I just think that ought to be clarified a little bit.
yeah, I had a first yesterday. I never realized you had to charge your phone halfway through the day because you got so many phone calls.
I have a charger in my tractor, and it never shut off.
It's my understanding that the local school boards have the jurisdiction over their district. They can set policies. Can they be more restrictive or less restrictive than what the executive order is?
They can be more restrictive, and we signed a thing a resolution at the last meeting for them to be less restrictive also, so they can make their own decisions.
So when the school districts, like football practice stuff, it's their decision. It doesn't come to us to make the decision.
Yeah. I think they were wanting to follow Shannon's health orders.
Because they have home rule, right?
Mhm.
So the schools and school districts can set their own policies.
Mhm.
So even if you say, like if it goes into phase 2 or 10 or more active cases, you know, you shouldn't have more than 15 students in a classroom. If you have 15 students and the teacher, which would be one over, if they decide that's all right, then that's all right, because they can set their own guidelines. Okay.
It just bothers me that we're trying to keep people safe and healthy, and there's always something wants to bend the rule. I mean, I know we have the responsibility of public health, but we can't force people to. You know, we can recommend. And I think we've said this many times that masks are appropriate, 6-foot distancing is appropriate, and wash your hands. What else? What else has to be done? We're not a dictatorship. We're not a communist country.
And that's not what I'm trying to do. I'm
Yeah.
just trying to keep our businesses and our schools open. If
Absolutely,
we
and I
don't do
agree.
something now, it's gonna be a problem, especially with the one case we got yesterday. We worked on that literally from 7:30 until 5:30. And we're still not even done.
Because we want people healthy.
Yes.
I think the mitigation plan is really good. There just needs a few very small tweaks to it,
Okay.
so that when people call, we know, okay, here's what it means. So,
Okay.
So what's the exact wording you want on that, so she knows exactly what to put in there?
I would say,
Take the line underneath for the 30 gatherings and put if 6-foot social distancing can't be maintained.
I just continued, I took the period off allowed and said allowed per room unless 6-foot social distancing can be maintained. And then period, churches are exempted per federal judge John Broom's decision as of April 18th, 2020. If you could read my writing at the bottom. The first word was allowed.
So are you talking about changing that first sentence on the social, on the mass gatherings? Unless 6-foot distancing can be maintained. Do you need to put the per room?
I think, yeah, I put it on here.
Because that clarifies for the
Because
schools.
that would help the schools, it'd help the courthouse, it'd help any place that can divide people up into rooms.
You know, Clay, you talked about just people whining and complaining about not wanting to be safe. The majority of the calls I had were just wanting to clarify, since, this decision from the Stafford County Board of Commissioners, they were looking for clarification from me on as far as what do we need to do, because they do want to follow the rules.
Okay.
So, I mean, I would say 3/4 of my calls that I had were, well, do we need to do this, or we do need to do that?
I would agree, most of them, 99% of them were wanting to follow the rules, they just didn't understand quite what they needed to do.
And that's the only bullet point you want changed. Do you want to maintain a 6-foot social distance in public areas left in or take it out?
I'd leave it in.
On the bottom line, so like, if we do this for the social distancing, would that cover Welch's venue down there for like wedding receptions and stuff like that, where the bottom line says no large entertainment venues? I mean, if he's outside, then that
All the
number,
venues are outside there, there's no employee rooms at
Okay.
all.
I
I'll
didn't
just
know.
put that are indoors.
Yeah, okay. I know you explained this the other day, but like where we have active cases, if they test positive, and as long as they show symptoms, and then once they don't have symptoms, how many days after that are they not active?
So it's 10 days from symptom onset or 72 hours with no symptoms, whichever is longer for their isolation period. But so far, we've had nobody that has had no symptoms after 10 days from their symptom onset. It's been longer.
Okay.
So
it's
once
10
they go
days.
asymptomatic, they have to stay home for 3 more days to make sure that they don't have a symptom pop back up before they come back out of their isolation.
Okay, 72 hours after their symptoms are done. Okay.
And then for the household contacts, if they have household contacts, their 14 days don't begin until the positive case is asymptomatic. So they stay for 14 more days inside their home.
Okay. So if you're in the household with somebody that has coronavirus, I mean, you're basically supposed to be quarantined then.
The whole
and then
time
you've
that
got
they're sick
another-
and then another 14
So
days
they
after
could be
their
looking
illness.
at a month in the house?
Let's discuss a little bit about HIPAA and what the requirements are. I found out that schools do not fall under the category of HIPAA. I didn't realize
They're
that.
mandated reporters
Yeah.
too, so they have to tell us their contacts at the school.
So I'm just wondering if the public is aware of what the federal regulations are in saying, oh, you have it, you know, and it becomes public. That by law, we can't name a person, we can name a location, general location. But other than that, we're bound by law by not disclosing who that individual is. I think some people are frustrated because they, well, I want to know in case I come in contact with that person. And I said, as long as you don't have symptoms, you're okay. But we don't know, and if we did, we couldn't tell you anyway. And they, well, that's not right, we should know. But it's a law.
It's the law.
It's the law, and I answered that question yesterday and told them it's a law. And I can literally lose my nursing license for not following that law and then have like a gargantuan fine that I could never pay.
Right.
I'm not gonna lose my nursing license that I worked so hard for over something like that. I'm not going to do that, and I'm not going to do that to the people that are at home. I mean, people were crying on the phone whenever I called to tell them that they tested positive and gave them all of their instructions. I'm not going to put them through that stress of having people isolate them more than they already are. That's not fair to them.
It's cut and dried, it's the law, I mean, you just gotta do it.
And I know people are mad, but they need to kind of turn the tables and think if that was them, if they would want that done to them.
I agree.
If that person wanted to come out,
Yes,
that's
if they
fine.
want to tell it themselves, that's fine, but we are not going to do that.
Right. Yep. Anything else you want to discuss or tweak or? I would open it up for comments from the public for 3 minutes if you wanted to say something.
I have a simple question for you guys. Percentage-wise, did you get more calls about school or everywhere else?
I think my percentage was the schools wanting clarification, you know, from teachers and from school board members, wanting to know more clarification. But it sounded like Shannon met with a lot of them yesterday, so hopefully they'll be talking to their superintendents and they were just kind of all up in there and not wondering what was going on. I had a few calls from churches, and then I had a couple calls from Welch about his venue, and it would be the only business that I know of in Stafford County that it would affect as far as shutting down the way it was written. But the way it is now, as long as they do social distancing and wear masks, I mean, even if they do the social distancing, they should still wear the mask, right? Yeah.
Am I wrong that the school is actually responsible to the Kansas State School Board directly, and you guys are an offset for the county and everything outside the door?
Yeah.
I mean, what I'm saying is actually the person, because the governor got overrode by the Kansas State Athletic Association. Kansas State School Board in the original proposals. And isn't the school not responsible to you guys? They're responsible to Topeka.
Yep.
And it seems like the calls that I've got anyway, and it hasn't been really horrible, just seem to be a diversion. For some reason, they don't want to call Topeka either, you know, because, you know, your motions really affect from the school door out. And the Kansas, or the, what do they call it, the campus out. And the school board actually runs the show from the front door in at the school. Her suggestions are just that. They can do what they want to.
On my opinion, and this is just my opinion only, I feel like school boards and schools are wanting to try to follow the health nurses' guidelines as close as they can on fear that there could be a lawsuit to the school. And then if they follow the guidelines of the health department, they can say, you know, we're following the health department's guidelines instead of just going rogue and coming up with their own deal. Then if they do that, they are totally responsible. So I think that's why they're trying to follow the guidelines of the health department.
I was just curious, you know.
The executive branch and the Kansas State Board of Education is who they answer to.
Right. But seemingly they don't want to contact them.
Any other comments? Mary?
I'm just kind of speaking as a mother and an aunt of two of these girls that work at the health department. I'm totally behind them 100%. And I feel like that you guys all need to be behind them too. And when they're putting in overtime, I feel like they should be very well compensated for that. And when people call and ask them, well, why can't you tell us where it's at, what town it is? They can't do that. And just because if we are who we are, we shouldn't be asking them either. And I just feel like that is just how it should be. You
I
know, it's
agree.
just,
I've
you
had
know,
hundreds of people ask me, and I said, I don't know, and I don't want to know, and if I did know, I wouldn't tell you, so.
So, but I also did look, you know, I was reading on Facebook, you know, there's been a bunch of nasty comments about what town it's in. Well, I guess my thinking is, and for people that are having problems with them not being able to tell them where it's at, if they don't feel like they're doing their job, they need to contact the United States Department of Health and Human Sources, because they're the ones that wrote up this HIPAA. So,
Yeah.
you know, and I mean, if there's any type of COVID extra funds out there to give these guys a bonus or whatever, I would hope that we would all be behind them so that they could actually get a bonus. Shannon's pregnant. She does not need this stress. So, I just hope that we can just get through this, but I'm totally behind these girls and what they're doing, so 100%. So, and if this is the way it's has to be, then we're just gonna have to get used to it and do it. I mean, we're not the only people in the world that have to do this, so that's just my.
Well, Mary, to add to that, since the beginning, I have said and we have said that we're behind Shannon and the health department 100%.
Okay. I just think we should, but I'm just.
We've done a great job. Right now, we're probably in the fewest 10 per capita of counties in Kansas with cases. Yeah, I think that's because we have done a good job in the past.
I mean, and they are, you know, but I mean, that's like when they said, you know, if you've been in Whites, well, heck, I was in Whites, but they didn't tell me who it was. But, I mean, that person doesn't know who all was in Whites either. But that person doesn't necessarily have to live in St. John either, you know, because they have other employees that work from other towns in our county.
Right.
So, I mean, they didn't necessarily specify a specific town. So, but I just know from living in this county for almost 60 years, people are gonna pinpoint down. If you say, oh, it's in St. John, they're gonna say, oh, well, so-and-so hasn't been out for so long. They're the ones that's got the big C. So, I mean, I totally back them 100% by not telling what town it's in. So, anyway, that's my 2 bits.
Thank you.
Before we adjourn, I just want to clarify, because I got to make some phone calls after the meeting. So it's all right for churches to meet, and they need social distance,
They
6
still
foot,
need-
and still wear masks. And then on Welch's deal, as long as they're social distancing and wearing their mask, they're all right. Okay.
I think you have that typed up. I think it would be helpful to the health department if we actually approved that plan as a county board of commissioners. The new plan and re-release it as the new orders. Is that okay with you? Do you have anything that we can do that with? I think we'll get it drawn up right.
She's the one who draws it up.
Yeah. Can you draw that up? Give it to Nita. We will go ahead and approve it
Prove it
time
in.
being and then read it, and if we're okay with it, just let it go then.
If you approve it, though, you're gonna go with it. I mean, she's gonna type it exactly as you
I
guys
know.
stipulated, so.
I would move that as the county commissioners, we approve the mitigation plan as we redid it today.
Second.
We have a motion and a second to approve the mitigation plan as is rewritten today. All in favor, say aye.
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 Opposed, no. Motion carried. Anything else?
I'd like to do a 5-minute executive
We
session.
don't have that on the
Oh, we don't.
agenda.
Oh, we
Can't do it today.
Can I make a quick comment?
Sure.
As a hospital, we appreciate Shannon very much. She's been doing a great job, and it's not been an easy one because we're kind of on the same round too, and we appreciate what you've been doing. You've been doing a great job of staying on top of the health department part of it.
I feel like the communication and the flow of it just has been very well. Like, we've been in constant communication. Shannon's probably tired of me. At my midnight. So I feel like it's gone very well as far as we, as a county, working together, the LETC groups and everything. We've done great.
Thank you. Okay.
We appreciate everything you guys are doing on the healthcare deal. It's been an educational experience, I'm sure.
Hopefully one we don't have to do.
Something new we were doing.
Okay, we will adjourn.
We're gonna